Hi there, this is Hannah. I'm the in-house naturopath here at ImuPro Australia. This topic is an extension of Module 3A where I talked about cross reactions. This is called Mammalian Meat Allergy or MMA, and it's particularly important for Australian healthcare practitioners to be aware of this if you aren't already, because Australia has the highest prevalence in the world. And unlike with the CCD cross reactions that we just covered, mammalian meat allergy is potentially a lot more serious for the patient. This training video covers what you need to know, including what is MMA, red flags, typical symptoms, causes, and what do you and the patient do next. Firstly, what is mammalian meat allergy? It's a type 1 allergic reaction to mammal meat, could be red or white, beef, pork, lamb, veal, kangaroo, rabbit, etc. We will get to a longer list a bit later on. And for a percentage of sufferers, roughly 10%, they may also react to mammalian products like cow's milk or gelatin. Since it's a type 1 allergic reaction, it's mediated by IgE antibodies directed against what's called a carbohydrate moiety known as alpha-gal. And alpha-gal, which is pictured here, is present on the surface of proteins in all mammals, apart from humans and some monkeys. It was first described by Professor Cheryl Van Neunen in 2007 while working in her allergy clinic in Sydney. And thankfully, since then, people's symptoms were eventually identified and it's now quite well known. But unfortunately, Australia does have the highest prevalence in the world. The most typical symptoms of mammalian meat allergy are unexplained itching, hives, or skin rash. Often people will have gastrointestinal problems like nausea, vomiting, cramps, diarrhea. They'll usually seem to come out of nowhere. They may have the telltale difficulty breathing, swelling, also called angioedema. They may also have an anaphylactic reaction in up to 60% of cases, and those over 50 years old are more at risk of this. The largest problem with identifying MMA is that it does have a delayed onset of 2 to 6 hours before these symptoms occur. And for most of us, when we think of IgE reactions, we typically think of them occurring immediately after exposure. But in this instance, and in other instances as well, anaphylaxis can actually be more delayed. And similar to how CCD is induced by insect bites, mammalian meat allergy is transmitted to humans by the Australian paralysis tick called Ixodes holocyclus, which feeds on mammals. The alpha-gal is then transferred when the tick bites a human, which doctors say is made worse when you try and squeeze the tick during removal, because that's basically releasing more alpha-gal and increasing your risk of anaphylactic shock. And so this is why it's important for ImuPro practitioners to be aware of mammalian meat allergy and potentially how to spot it. Because of that delayed nature of the reactions, patients may bypass letting their GP know or getting testing with their GP, and they may come to you and ask for an IgG food allergy or some sort of intolerance test on their quest for some answers. And this brings us to a mini case study, which is actually really interesting. We had a 44-year-old male who presented to us for help with occasional unexplained ankle swelling. He did get lots of tests done through the doctor for it, but he wasn't able to find any answers. His ImuPro results did show highly elevated IgG to beef, goat, and lamb, and elevated IgG to deer, veal, and venison. So he thought that the swelling might have been a reaction to some Chinese food that he had earlier in the night, which did have beef. And further questioning revealed that he was bitten by a very large tick earlier that year when he went to the Amazon forest and he pulled the tick out of his chest himself. So his delayed IgE type reaction may be explained by alpha-gal present in the meat, which can show on ImuPro testing due to cross-reactivity. And we know that alpha-gal is particularly a problem in the Australian east coast, but it does happen elsewhere in the world. And amazingly, there was a case series on French Canadians who experienced mammalian meat allergy following exposure to a tick bite in the Amazon. And of the 11 patients studied, 5 of them experienced the angioedema. Interestingly, the reactions occurred within 1.5 to 6 hours. So it's probably important, even though resources may say 3 to 6 hours, 4 to 6 hours. Most recently, I found that it says 2 to 6 hours, but it may be important to exercise some flexibility with that timing so that you don't miss out on identifying alpha gal syndrome. This is another study from the European Journal of Allergy and Clinical Immunology showing the cross-reactivity of bovine IgG, which may predict beef allergy. And it's important to note that ImuPro IgG testing doesn't diagnose mammalian meat allergy, but the IgG results may predict or it may reflect it. We don't recommend using our IgG test to diagnose mammalian meat allergy, but we'll get into what you can use instead. So, unlike with the CCDs, where we had a number of false positives and we had to sort through what was clinically relevant, all mammalian meat allergy results are to be considered true positives and clinically relevant, and potentially serious because we know that they can induce anaphylaxis. So, if your patient does have any of those symptoms mentioned, and if after questioning you found out that they did have some meat before that reaction or animal product, then it may be a good idea to run a blood test to look at whether they have IgE antibodies against alpha gal or IgE antibodies toward the meat that they were eating. Could be beef, lamb, goat, pork, veal, or even kangaroo. And if you're not sure how to do that or run those tests, definitely refer them to the GP so they can get those tests done. And as many practitioners know, ImuPro are able to run IgE testing to foods, and we can test alpha gal as well, or you can ask your local lab like Lavity. While waiting for those results, or if it is confirmed, advise the patient to avoid all mammalian meats and provide them with a list of exactly what that is, which we'll get to in the next slide. And they will need to keep an eye out for a number of packaged products that may contain dairy or gelatin. It's quite widespread, so they'll definitely be needing to look at their labels. And you can find handouts on Allergy and Anaphylaxis Australia website. It's important with these patients to identify foods that are safe to eat, any food that's not mammalian, with the exception of if they do have a prior allergy or intolerance. The patient can have chicken, turkey, duck, eggs, fish, crustaceans, and mollusks, for example. And finally, the patient will need to alert their GP if they have identified mammalian meat allergy. It's possible that they're going to need a prescription for adrenaline, like an EpiPen or an Anapen, and an allergy action plan that they can have with them at all times in case of a severe allergic reaction. This is an allergen card and a chef card, courtesy of Allergy and Anaphylaxis Australia, where you can see a longer list of mammalian meats to avoid and products containing dairy and gelatin. Even things like chicken sausages are off limits because the casing can contain beef. Gelatin is often found in lollies, jelly, jams, additives, supplement capsules, and even energy drinks that have taurine. Patients with MMA are not being bothersome. They do need to be vigilant and alert restaurants who may otherwise unknowingly give them meat or meat byproducts. So it's a great idea to use this chef card. And since it's tick season at the time of recording this in August, you'll find that there are many news articles coming out now to warn Australians about the tick season and to try and reduce your risk of tick bite and subsequent alpha-gal syndrome. So it's a really good time to arm yourself with more information and have some resources available just in case this does pop up in your clinic. So there's some resources that you can access from Allergy and Anaphylaxis Australia, Australasian Society of Clinical Immunology and Allergy, and tick-induced allergies research and awareness. If you did want to chat with an ImuPro consultant about any of this, please feel free to call or email us. And I hope this was a helpful webinar for you. Until next time, thank you.